Welcome back to Your Checkup. We are the patient education podcast where we bring conversations from the doctor's office to your ears. On this podcast, we try to bring medicine closer to its patients. I'm Ed Dulesky, a family medicine resident in the Philadelphia area.
And I'm Nicola Rufo. I'm a nurse.
And we are so excited that you were able to join us again today. By the grace of God, am I awake right now?
I know. I don't know how you're sitting upright.
Resurrected. So that's that. I had a 24, I guess yesterday from the day that we were recording this into today. Mm-hmm. But it's so important to me that we do this. And so here we are, getting ready to talk about different stuff. What are you drinking over there?
I have another Olipop, an orange one.
Is it weird to say I'm drinking a Miller High Life on
No. It's like 5:30. It's an appropriate time.
I think so. Oh, so what's been going on? So this last week it was more inpatient.
Yeah.
For me, lots of time away from
Eddie
home.
continues to be a slave to the hospital. Only one more week of that.
Last one.
Thank God.
Yep.
We're hanging on by a thread over here.
Our intern, who has been quiet all day, we sit by the mics, we get tuned up, and we say the intro, and then he starts yelping a little bit.
Oh, because his drugs are wearing off.
Maybe. Well, he's up to 10-minute walks at this point.
Yeah, we added 10-minute walks. He's doing great.
And a couple extra medicines to make him calm.
We're getting into week 3. Yeah, I took him for his... Was that this week or last week when I took him for his follow-up?
Yeah.
Took him for his follow-up. Everything looks great. He doesn't have to wear the cone anymore.
Yep.
Got some more medicine to help him. 6 more weeks.
Moved the car back to New Jersey so that the PPA can't track down my car anymore and give loads of tickets.
Do you know, I recently learned, I don't know if you knew this, you also don't have to keep this in here, the PPA isn't like regulated by Philadelphia. They're like an independent thing and they can just like do whatever they want.
Well, that makes sense because they like raised the prices 5 times.
Why they are the way that they are. They can't be managed.
Well, there's no way to be able to predict their behavior when it comes to giving tickets or not giving tickets. Like some people in our neighborhood are like, oh yeah, just park the car and they won't give you a ticket. And then seemingly in the last 2 weeks, we got like 4, which was an expensive endeavor.
Yeah, they're wild. The PPA.
Yeah. And most importantly, Sunday gravy.
We're having Sunday gravy. Yeah, Eddie walked in from his 24-hour shift this morning and it was already all done. The meatballs were cooked. The sausage was in there. Everything was simmering.
And this was early. I mean, you were hacking away.
Yeah, it has to simmer all day. That's how it tastes good. That's the trick to getting a man to marry you. Just be the best at making his favorite meal. His favorite meal is spaghetti and meatballs, and now it's really your favorite meal.
Oh, wow.
That's the only reason he likes me.
That's not true. All right. So we have been doing a long run. I think I counted 7 episodes on weight management, and it is time to shake it up and recommit to our variety.
Back to peds.
So it's back to peds. So if you don't enjoy peds, you can just gleefully skip along. But no, you should actually continue listening.
No, you should listen to it.
Because whether for yourself, a loved one, or
a pediatric neighbor,
this is important information for you. So please tune in. So today, Nick, why don't you ask me this time what we're going to talk about so that I can tee you up?
Well, Eddie, what are we talking about today?
Today, we are going to talk about cold and flu season.
Yeah, we're heading into cold and flu season. It's September 15th when we're recording this. So we are heading into that fun time of year, and now we're going to talk about it. And specifically in like infants and kids. Mm-hmm. If you're an adult and you have a cold, specifically if you're a man adult and you have a cold, you'll be fine. Take some Dayquil and go to work.
But let's say that you aren't, and let's say that we're recentering ourselves on some peds. Mm-hmm. Tell me what causes a cold most commonly?
A cold is caused by a virus. There are a bajillion viruses out there.
What's the most common one?
Put a specific number. So rhinovirus is typically what causes like the common cold. RSV is a big one in kids, which we'll talk about. Like adenovirus, that's another like nasty one.
Yep.
Human metapneumovirus. That's a bad one.
Literally at the same exact time.
That's a rough one. The OG coronavirus.
Right, because there were coronaviruses before COVID.
Yeah, like multiple. Yeah.
Yep.
So, and the flu.
Of course.
The flu is a virus.
Preventable.
It is.
Wow. So are certain like age groups more affected? Like, you're under 2 years old. How many episodes of a cold or can you expect?
So typically most kids by the time in their first 2 years of life, they'll have about 8 to 10 colds.
Oh my God.
They could even have more if they're like going to daycare or there are older siblings who are in school. Kids are just like little petri dishes. So
I feel like if you like look at a kid and they just kind of look unwell, it can be a little disarming. Like if they're not bopping around doing their usual thing. But if you're seeing that someone has or you're thinking about a cold, what are we thinking about? Like, what does that look like?
I mean, so typical cold symptoms, and this is like not a hot take because this happens to everyone when they have a cold. So a fever, which is a temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius. 99.8 is not a fever.
Yes, this is a very important point.
It just isn't.
Right.
Unless like you're the anomaly and your like regular temperature is lower than average, and then
like very specific rare
very
circumstances.
specific rare circumstances, your temperature of 99 is not a fever.
This is a
That's
good point. Right. Well, because people will come back and they'll say like, "Oh, I had a fever," and it changes what I'm thinking about like is going wrong entirely. So 100.4 degrees Fahrenheit.
Cough, congestion, runny nose, sneezing.
Okay.
And then fussiness and specifically poor feeding in an infant or a child.
Like a baby.
Yeah.
Gotcha. So we mentioned that most colds are caused by viruses because it's distinct from a bacterial infection. Both are in the family of things that can make you feel unwell, but bacterial infections, which are exceedingly far less common, are usually treated with antibiotics. But it's so overwhelmingly common to have a virus, and that specifically does not get treated with antibiotics, which over the course of the last 20 or 30 years kind of has maybe led to some issues like overtreatment with antibiotics for things that aren't bacterial. That's my quick soapbox on that. Are you ready to
an antibiotic will not cure your cold.
Exactly.
Is what
in
we're
plain
saying.
English.
Or your flu.
There we go.
Or your RSV.
Exactly. So we mentioned a bunch of different names of viruses, but how does someone know which virus their kid has?
So there are like viral panels or like nasal swabs that you can do. It's the same thing as, I mean, I'm sure everyone knows what it's like to get like a COVID test now. So it's the same thing as that, where it's like the little Q-tip thing in their nostrils and then send it off to get tested. There are, this also is probably like hospital dependent. I think most have just like the flu and RSV one, and then there's like the full one that tests for all of like the most common viruses. I don't know if it's typically done in the doctor's office, like the pediatrician's office. I actually have no experience in a pediatrician's office, just only in a pediatric hospital.
I've seen rapid flu tests and rapid COVID
flu.
tests.
Yeah.
Just because in those specific circumstances, in the right timeline, they might change what you do to treat what you're seeing in front of you.
Yeah. But typically really, like if you're going to the hospital, you're probably getting it just kind of as like the protocol and like the order set of everything that gets done. If your kid is at the hospital with these viral like symptoms, not always done though. It really kind of just depends. Like I think sometimes it depends on the doctor and how sick your kid looks, to be honest. And knowing specifically what virus your kid has really doesn't change the treatment. Like if it's flu, and you want to know if it's flu, and within how many days is it for Tamiflu?
Usually like
3 days, 2 days. And, that's something that would like alter whatever treatment that you're doing. But, if you're differentiating between even like RSV or rhinovirus or adenovirus, the treatment's all the same. It's still the same like, supportive management.
Absolutely.
So I know some people they want to know what virus their kid has, but in the grand scheme of things, it doesn't make a difference.
It won't matter.
Yeah. It might give you an idea of like things that might happen. Like if they have RSV, like that classic 3 to 5 days, they have adenovirus and their eyes are gunky. Like that's probably why. But really, it doesn't matter.
But we do know for sure that it makes everything more expensive.
It does. They are expensive.
Yes. Hundreds of
I think
dollars,
so,
I believe.
yeah, for like a full viral panel.
Yeah. And like, I'm not sure where or who eats the cost, but I mean, there are like efforts to reduce the amount that we're using these in these situations because they're so terribly common.
Yeah.
The colds that rather.
Mm-hmm. So, yeah.
So there are a lot of viruses that give everyone fits. You mentioned a bunch of them. You mentioned rhinovirus, human metapneumovirus, but there's one in particular that we're going to talk about next that gives a lot of trouble. Which one's that?
So we're going to talk about RSV. Freaks out a lot of parents because it's really scary. It's the number one cause of hospitalization in children under 1 year old, which is kind of crazy. And about 2 to 3 out of every 100, we'll just say infants who get RSV will require hospitalization and like being at the hospital, staying overnight, the whole to-do.
Wow. It's a big deal.
Yeah.
To have to be in the hospital, especially that young.
It is. And it's really, I feel like specifically with RSV, at least in what I've seen, and like I've seen a lot of it.
Seen a lot.
Your symptoms can really like turn pretty quickly, and it's not, so it very classically follows the typical like course of a virus where, and the way that I usually explained it to parents was like, you feel kind of crummy for like a day or two, and then it's like one day you wake up and you feel like you got hit by a bus and it's like the worst day, and maybe you like stay home from work and then you kind of just like gradually get better from there. With RSV, that is actually like the exact pattern it follows. So typically around day 3 to 5 is when it gets worse. It's like pretty much like textbook, like it will get worse on day 3 to 5. And it's not necessarily like more of a common cold, like say rhinovirus or something where you're kind of like steady, nasally congested, coughing, and then you just like gradually get better. RSV, like you will get worse and you do get worse. And we would tell parents that too. And like, I can't count how many parents have even said to me, like, like this morning we were at the pediatrician and everything was fine and they told us to watch her, and now it's 6 hours later and we're in the hospital. Yeah. But like that, you probably were fine in the morning when you were at the pediatrician, and then it does really turn kind of quickly.
And that's like no one's fault, right?
Yeah.
Like,
and like people will
happens.
specifically ask you, which you'll notice like the doctors and the nurses like in the hospital or at the doctor's office will like specifically ask you like, what day of sickness is this? Or like, what day did they start showing symptoms? Because then in their head, it's like, okay, are we nearing day 3 or are we nearing day 6 and potentially getting better? Or are we at this like 3 to 5 day and we need to like watch out and wait
So
to
it's
like
almost,
see if it'll get worse.
if it's like early on, that advice is key where like you have to keep an eye out.
Like that would be key for us, and like probably you guys too, like when we would give like sign out to night shift, like telling them like, okay, it's Sunday, they started getting sick on Friday, so like tonight into tomorrow they might get worse, and then that's just kind of good for everyone to know. Just like typically like most viruses, it can last about 7 to 14 days.
That's a long time.
Yeah.
Wow. Are they in the hospital that long?
No, so
I feel like they usually improve to a point when they don't require the hospital, but they're not quite back to normal yet.
Yeah, so like if you are in the hospital, they're probably requiring some sort of oxygen therapy. if they're not drinking well, they might need an IV to get some fluids. So once they like don't need any oxygen, and once they're eating and they're making wet diapers and everything, then you can go home and kind of like finish it out at home.
So we've talked a lot about the name RSV and different viruses, but how does that relate to bronchiolitis?
So bronchiolitis is something that can happen along with RSV or really any virus. It's just inflammation of the smallest part of a baby's lungs. So if you think of inside your lungs as kind of like a tree with branches, so you have the main like breathing tube going down, and then it separates, which are like the branches of the trees, into each lung, and then like the leaves of the trees are like at the ends of those like tiny little breathing tubes in your lungs called the bronchioles. And when a baby is sick, everything in a baby is small. So like their airways, everything are smaller. And so they get clogged up with the junk and the mucus from being sick, and then causes some inflammation, makes it harder to breathe. Sounds similar to like bronchitis, which typically like an adult or like an older child or teenager would have. Bronchitis is kind of like that similar thing, just in like the bigger airway up top, if that makes sense. And bronchiolitis is another, it's like diagnosed by your symptoms, right? There's not like a test to test for bronchiolitis.
Right.
So symptoms of bronchiolitis are essentially all of the cold symptoms, but worse. Rapid breathing is a big one. And then your work of breathing actually is the biggest one.
Ooh,
so things to look out for in your child or your baby, specifically the baby, to know if they're like really working hard to breathe. They'll have like nasal flare, so their nostrils will be moving as they're breathing because they're breathing so hard. Your baby will just like be laying flat, or maybe you'll be holding them and you'll notice like their head is bobbing up and down when they're breathing. If you like lift up their shirt, that's like a big assessment piece. I feel like looking at a baby's belly to see if their belly's moving up and down. If they're like grunting or like cooing, that's the bad sign if they're grunting. And then using what is called their accessory muscle. So you'll see kind of like in that like divot above your collar where like your neck meets your collarbone, or really under your collarbone too, is like sucking in, or like on the sides of their ribs, you'll like, sometimes that's like scary. Sometimes they'll be like breathing so hard in that like when they breathe in, you can see all their ribs.
Yeesh.
So those are all not good signs. And honestly, if your baby's doing that at home, like don't even call the doctor, just go to the hospital, because things are probably going to get worse like quickly.
So, I mean, we painted a pretty scary picture of what this all is. Please tell me there's good news and that there's a treatment.
So there is good news. Well, the bad news is that there really is no specific treatment for RSV or any cold.
Damn.
However, it will get better. The treatments really are just supportive treatment and symptom management.
Okay.
Again, an antibiotic is not going to fix your RSV or your cold. There are like circumstances where like having a virus and being sick can put you at a higher risk for like a secondary infection. So some kids like will have a cold and then might get an ear infection.
Yep.
And then you would need an antibiotic for that. But cold alone, no antibiotics.
Exactly.
If we haven't said it enough. So main treatments, again, like we kind of briefly said before, I mean, like specifically in the hospital, you'll either be on some oxygen or like a higher flow with some added humidity just to like help the work of breathing. You might need IV fluids again if the baby just isn't drinking. And I mean, all of those are, same symptom management at home. So unless you need oxygen, obviously you don't have that at home, but biggest thing is that you want to make sure that your baby is drinking and making wet diapers pretty much like how they normally would. Like the amount of wet diapers that they typically would have is kind of what we're aiming for. It can be hard for a baby to eat when they're not feeling well or when they have a cold and they're like, it's hard for them to breathe and their nose is all clogged up. One, because if they're breathing so fast, they can't breathe like 70 times a minute, which is very fast for a baby, and like suck on their bottle and drink. And that's also like not really safe because like you can aspirate if they do that. Like even in the hospital, if a baby is breathing over, it's usually over 60, like we just don't feed them because it just kind of gets into that unsafe territory. And I mean, it's hard. So like if you like plugged your nose and then if you were trying to like drink from a bottle or like drink something out of a straw, well, that's just a cup. You can do that. Like you can't do it.
Oh, yeah. Well, this was a bad example.
So that's like what a baby's doing. So a baby can't not breathe and eat at the same time. It just makes it hard.
And babies can't blow their noses.
Babies cannot blow their noses, unfortunately. But you can suction out their noses, which is another thing that we do in the hospital. We have like the nice wall suction that are very strong. It's so satisfying. I love suctioning. But you can either just use a bulb syringe, which honestly, bulb syringes don't do a whole lot, but that's what you got, then use it. You can use a nose Frida. We don't have children, but I don't know that I will ever be using a nose Frida. And then it does just kind of freak me out. And I know there's a filter, but do you know what that is?
Only because of like work, but I didn't know about it beforehand. Can you describe what that is? Yeah.
So the nose Frida is basically like a long tube, and then there's a filter, and then there's a part where you put your mouth on and you put the tube part in the kid's nostril, and then the parent like sucks out all the snot. And there's like a filter in there, and it doesn't get into your mouth. It just freaks me out. I don't know. We'll report back if we ever have fetuses, but
I mean, but just like I can't even imagine like having a stuffy nose and not being able to blow my nose.
Yeah.
And like how infuriating that would be. Like it's just I take it
especially you're like an aggressive nose blower too. So
yeah, I use paper towels.
Yeah.
Because blow a hole right through it.
You can also buy on like Amazon, you can get like an electric suction thing if that's something that interests you. But a good tip is to suction out their nose before you feed. So you kind of like get all the gunk out at least temporarily, let them eat, and then gets the job done as much as you can. Maybe it'll keep you out of the hospital. Got to get ahead of the dehydration, especially like if they're breathing faster, you have a fever, like there's a lot going on there. Yeah. Keep them hydrated.
Yeah, that's like the big thing, right? Is that like that's a big reason to be in the hospital is the hydration status.
Yeah. I do want to talk about milk, whether it's formula or breast milk, or like whole milk and regular milk if it's your toddler, because I think like a common thought is like to not give milk when you're sick because it'll make your mucus thicker. I've like heard that a lot. But milk doesn't have any actual physical effect on the consistency of mucus. Milk itself is thicker, so it can be a little bit more difficult for a kid or for a baby to drink. But like if that's, especially if you have a kid who like loves milk and that's what they're going to drink when they're sick, give them the milk. You can also cut it. If it's a baby, you can cut the milk with a little bit of Pedialyte, or you can just give them Pedialyte. Don't give them water and don't cut the milk with water.
See our third episode.
Yeah. And for like specific mixing instructions, you can ask your pediatrician, but that is an option and it might be something that they suggest. It'll just like make it a little bit more thin and then easier to drink, and
it just like ends up being a little bit easier for them. Okay.
Yeah. Do you like ever hear parents say that?
I like remember,
or like even like growing up, like don't drink milk when you're sick because it makes it worse, but it doesn't actually do anything to the mucus.
I'll try to keep it simple. No, I actually haven't heard too much of that. Maybe in GI, like diarrheal illnesses, but not in this specific circumstance. I've seen the practice of, like, for those children who don't eat, like breaking it down and going to Pedialyte, and somehow that was helpful. But it sounds like it's because it's a little easier to tolerate because it's not as thick, which I never really understood why that just happened. It was just kind of like a do this and see if it works for their hydration status. Yeah.
That's why. But you can give milk if your kid has
a
stuffy nose and there's a lot of mucus going on.
Yeah, it doesn't sound like
I've just heard that a lot, so
it doesn't like a good reason to not give milk.
Yeah.
Give milk if they want it. Let them drink milk.
Oh my God. And then another part of symptom management are medications, which we are going to touch on. Specifically Tylenol, Motrin. Again, talk to your pediatrician. Make sure that it's all good to give your baby either one of those. I will say if your baby's under 6 months, we're not giving ibuprofen, only giving Tylenol.
Harsh on the kidneys, if you will.
Yeah.
And the kidneys are
just too little and
too tiny.
Yeah, too tiny.
So Motrin also goes by the name, or ibuprofen goes by the name of Advil and Motrin. Yeah. So all of those are off the table for a baby before 6 months and under.
Yep. Another like tip that your pediatrician might suggest, if it's safe, your child's old enough, they are safely able to take Tylenol and Motrin or Advil, whatever. Both of those you can typically give every 6 hours. So we would always alternate giving one of them every 3 hours. So like Tylenol at 12, Motrin at 3, Tylenol again at 6, Motrin again at 9, and kind of go from there. Because it kind of just like, along with all of the other cold symptoms, then you also are like achy and have a fever, and staying on top of that really makes a big difference. Even just like a dose of Tylenol, sometimes like in the hospital, we would have a baby who, it's actually kind of crazy what a fever will do to like an infant.
Right.
Because we would have kids like, I would be like, oof, you like might be in the ICU in a couple hours. And then they had a fever, give them a dose of Tylenol and fixes them right up. The all curing drug. So
it's more centrally acting, and it really does get at the fever and central. And when I say central, I mean like in the brain-ish perception of pain. Whereas like ibuprofen or the class of NSAIDs gets at the inflammation symptoms. And so if you're thinking even for like yourself, if you're thinking about doing that, those are the kind of the logic. That's the logic that happens.
Yeah.
That exists behind those medications.
Next is, we'll touch just 2 other things. Cough and cold medicine, we're not giving.
To who?
If you're under 6 years old.
Okay.
It's just not recommended. What?
6 years old. It's kind of old.
Yeah. It is not recommended. And also like a big thing. So want your kid or you want your baby to be coughing all the junk up and getting it out.
Yes. The productive cough.
Yes. You want them to cough it up because you can't like everything, like their airways are so small and they get clogged up so fast, and like it's going to suck listening to your baby cough or your kid hacking up a lung, but it's actually a good thing because it's clearing everything out.
Oh, totally.
As best as it can.
Let the productive cough ride.
And then last thing, I don't know. I feel like we're going to touch on aspirin. I feel like sometimes aspirin is like people's go-to drug, and that's fine if you're like 60, but, maybe your cardiologist told you to take a baby aspirin every day. Don't give that to your kids. We're not giving it actually before age 16, unless for some other reason your doctor has told you to give your child aspirin. Like if they've ever had Kawasaki disease, you're going to be on aspirin for a little bit, but that's like a very niche, rare thing. So not giving aspirin, because giving aspirin in the setting of a virus, I believe specifically chickenpox and the flu actually will cause Is it Reye syndrome or Rye syndrome? I always forget.
I think Rye syndrome.
Rye syndrome, which just causes like inflammation in your brain and your liver, and it's bad. So
You ever seen this?
I haven't. No.
Me neither. I would have, if anyone between the two of us had, it would be you. Yeah, I actually don't know how commonly it happens. Of course, we're not doing it, but like,
No.
period. But there's a recommendation for a reason. It's like goes back to the vaccine. It's like people are like, oh, why would I haven't seen measles in my life. Why would I
It's
get
like
the
that's because
MMR?
you got
It's because
vaccinated.
everyone's vaccinated.
Yeah, but some people, my dad loves an aspirin. Even like when Ollie hurt himself,
Yep.
he was like, give him an aspirin. I was like, oh my God, he's going to try to give my human child aspirin.
That's awesome. So that was a nice walkthrough of the medicines. And now, like, say that someone's like over 6 years old, and there's some caution to not using like pairs of these medicines together because like there's Tylenol in cough and cold medicine oftentimes.
You know, like an older kid or a teenager or yourself, even like as an adult. Cold medicine and cough medicine typically is like a little cocktail of different medicines, of different like cough medicines to either like suppress your cough or medicine to help like get everything out, like an expectorant. And then it typically has Tylenol in there too. So not ideal to take that like cough or cold or flu medication and then topping it off with some more Tylenol.
Yes.
It's going to overdo it.
Yeah. Specifically on the liver there, to the tune of why it's safe to go back and forth between like ibuprofen and Tylenol is that their side effect profiles are on completely different separate parts of the body. So I think even my parents were like, oh my God, this was a revelation to them a couple years ago that you could alternate or you could take them at the same time. Or take them at the same time if you're a grown adult, which is also not medical advice. I mean, so we've had like a really great general discussion about all these topics, but so why don't we take the last part of the episode and go through some things that you should be seeing and then call your child's doctor right away if you're noticing these things.
Yeah, so a few things. Okay, so reasons to call your doctor. I mean, you're their parent. Call your doctor whenever you want to. But specifically if they're having all these cold symptoms and then also have like a stiff neck, definitely call the doctor. If they have a seizure, I mean, regardless of if they have a cold or not, if your kid has a seizure, you're going to call a doctor. You're actually probably just going to go to the hospital. I don't think we touched on this, but if your baby is under 3 months old and has a fever, definitely call the doctor. They will probably tell you to go to the hospital.
The reason behind that is because the baby's immune system at that point is very underdeveloped and hasn't had the full complement of the pediatric vaccine schedule. And so any fever in a child of that age is considered an emergency.
So, yeah, the doctor will probably tell you to take your baby to the hospital.
What type of hospital?
Oh, if you live within a driving distance of a children's hospital, go there. Yeah, don't take your kid to an adult hospital.
Can you give a quick little, why?
So the reason is that, I mean,
and this is our own opinion.
In an adult hospital, they just don't know what to do with kids, like the nurses and the doctors, because that's not what they do. And in a children's hospital, they're only taking care of kids. It's actually kind of funny if a parent was ever ill or had to go to the ED, everyone's we don't know what to do with this adult.
Yeah.
If you are in a safe driving distance to a children's hospital, please take your kid there. And I've seen patients who went to an adult hospital first and then they get to us and we're all oh my God, what did they do? What were they doing over there? Yeah. So just to be transparent.
Totally. Yeah.
If you can, just don't.
Obviously, if the closest place is
yeah.
and there's an absolute drop dead emergency, go to the closest one.
Yeah.
But if you can afford it and there's like somewhere around, I would think twice.
Yeah.
Head to a children's hospital if you can.
Let's see, a fever over 100 not 100 degrees, 104 degrees Fahrenheit or 40 degrees Celsius repeatedly. And then if your child is younger than 2 years old and their fever persists for more than 24 hours, you should give their doctor a call.
Yeah, because at that point, there's like a bunch of things that it could be, and maybe you need to be evaluated and listened to, had the ears looked into, look in the throat, see what's going on.
Mm-hmm.
So as we're wrapping up here, we had a brilliant conversation. If you couldn't tell, this episode was produced fully by Nikki herself, and that's why it's one of our winners here. But you'll notice that we gave a nice introduction about colds. We spent a lot of time talking about RSV and bronchiolitis, but notably didn't talk about vaccines. And getting a flu vaccine is super important, and we're planning on doing an episode coming up soon as we enter the height of, or just the very beginning, rather, of flu season, where we can talk about that as well.
Cool.
All right, so we are so happy that you were able to join us again today. Hopefully, you were able to learn something for yourself, a loved one, or
a neighbor with RSV.
And please check out our Instagram. Please email us at yourcheckuppod@gmail.com. Or send us some fan mail. We're always looking at it. We didn't actually have any fan mail this week.
I know.
So
from our loyal listener.
So there's no fan mail.
Did we talk about how we have a listener in Dubai?
And as we really wrap up here, we can shout out that we have a listener in Dubai.
Hope you're still listening.
Hope you are still listening. We've got some, I saw some San Francisco, West Orange, San Francisco of California, of course, West Orange, New Jersey listening. So we're really grateful for anyone who's tuning in.
West Orange, New Jersey.
New and old, who is listening to us here. Thank you for coming back, and hopefully you can tune in again next week and hear whatever topic we decide to discuss about then. But most importantly, stay healthy, my friends. Until next time, I'm Ed Dulesky.
I'm Nicole Rufo.
Thank you and goodbye.
Bye.
This information may provide a brief overview of diagnosis, treatment, and medications. It's not exhaustive and is a tool to help you understand potential options about your health. It doesn't cover all details about conditions, treatments, or medications for a specific person. This is not medical advice or an attempt to substitute medical advice. You should contact a healthcare provider for personalized guidance based on your unique circumstances. We explicitly disclaim any liability relating to the information given or its use. This content doesn't endorse any treatments or medications for a specific patient. Always talk to your healthcare provider for a complete information tailored to you. In short, I'm not your doctor.
I am not your nurse.
And make sure you go get your own checkup with your own personal doctor.